Well, good afternoon, everyone, and welcome to the Progreso Latino Fund's Forum on Healthcare Access. This is the first in a three-part series of forums on critical issues affecting the Latino community in Greater New Haven, and it's fitting that we're having this discussion during Hispanic Heritage Month. I'm Fernando Muñiz, your moderator for today's first ever online Zoom PLF forum. The Progreso Latino Fund has been building capacity and knowledge since 2003, when Frances and G Padilla asked a few of their friends to be founding donors. We've built a permanent endowment for grant making, policy forums, and leadership building activities of nearly $400,000 since 2003. Money raised for the fund has been used to sponsor educational forums and community events, a primary strategy and platform for bringing people together, engaging Latinos and non-Latinos alike about issues, and providing a vehicle for conversations about how the issues impact Latinos. Today's forum on healthcare access is just one of those vehicles. A couple of housekeeping things before we start. First, today's webinar is also streaming on Facebook Live, so your friends can catch it there. All participants are currently muted, so you'll only be able to see and hear from us on the panel. If you're having any difficulties, please contact us in the chat. Staff from the foundation will be monitoring the chat to see if you're having any technical problems. If you'd like to submit questions for the panel, please use the Q&A function and we'll be curating questions from there after the panelists speak. So now let me introduce our panelists. First, Maritza, who is the Director of Health for the City of New Haven. She's been working in the public health sector for nearly 20 years. And in her role as Director of Health, she leads efforts on creating a culture of health and wellness with a focus on addressing social determinants of health and health equity. And she will be followed by Frances Padilla, who is the President of the Universal Healthcare Foundation of Connecticut. She serves on the Connecticut Healthcare Cabinet, for which she chairs a work group on prescription drugs focused on costs and transparency and fair pricing. She also serves on the steering committee of the State Innovation Model Initiative, which is designed to improve community health and eliminate inequities. And they're both experts in this area, and we're really looking forward to hearing from them and also hearing your questions when we get to the Q&A. So let me first turn it over to Maritza for a presentation, and then to Frances for a larger policy discussion on these issues.
Good morning, and actually good afternoon. Thank you, Fernando, for the introduction and for the invitation to be able to take part in this first part of the three-part series of this forum. As it is an honor to be before all of you, thank you for all the participants and all the great work that you're doing in your respective communities. As you know, we are living in a new world of new norm of responding to a pandemic. It's been over 100 years since our country has seen such a significant effect of a virus that has been impacting everyone globally. And specifically today, I want to talk a little bit about how this has been impacted Hispanic and Latinx communities. I always like to make a quick disclaimer that this information is as of yesterday. This pandemic is very fluid and continues to evolve. And so I always like to make disclaimers because as quickly as we post data, it does evolve and change relatively quickly. You know, health equity and racism has been an integral part of the exacerbation that we have seen with COVID affecting communities of color at a greater rate. And so I want to talk about a little bit about that, give you a sense of where we are with the response and what are some of the things that we have done throughout the city to be able to address that within our communities. One thing that I like to always mention is that equality does not always equal equity. And so when we talk about how does that impact us, especially within the Latinx communities, I will delve into that a little bit more. One of the things across the country that has been a factor in trying to address and start moving the needle forward, and so excited to be part of this effort, is racism and declaring it as a public health crisis. And the city of New Haven has declared that, among with many other cities across the Connecticut state and other cities. This is globally what's happening in regards to positive cases and the impact of positive cases in our globally in our country, as well as within within the world. And so over 6 million cases, of which over 200,000 deaths have occurred. Specifically, what does Connecticut look like? And so this is sort of a map of where we are with COVID-19 within the month of September. And so when we talk about the impact of the percentages, across Connecticut, we have seen a percent of 30% impact of COVID-19 of our community in the state. Predominantly in the city of New Haven, we have seen their neighborhood of Fairhaven at a significant higher rate being impacted among Latinos and Latinx communities. When we talk about how has this impacted our city, we've had over 3,000 cases in our city, of which they were predominantly in Fairhaven in the Hill neighborhoods, and almost equally of impacting Black African Americans and Hispanic Latinx communities. We have seen 113 case fatalities within the Fairhaven, West River, and Dixwell Avenue neighborhoods. And so when we talk about the hospitalization as a reopening metric, we also saw that the Latinos were also at a greater rate of having positive cases. We also saw that we wanted to see what was these disparities and why the racial disparities are existing among communities of color. So we have done a lot of work around looking at the data, and we saw that access to testing early on was a significant issue with being able to have quality testing availability that did not consist of just mobile access, but really walkability. Inclusivity to the healthcare system has been a great challenge for communities and have been really expressed throughout. Employment has impacted Latinx communities at a significant higher rate than other communities. We have seen a health insurance gap within our community as well. 11% of Latino adults having access to proper quality insurance. The ability to telecommute, as many of us had a luxury to be able to work from home, we find that 16% of Latinos reported that they were not able to have that ability. Transportation insecurity, 26% of our population in Greater New Haven have access to proper transportation, and as well as food insecurity. Other things that are impacting Latinx communities at a greater rate is mental health and the impact that mental health has had a toll because of COVID-19. We also know that comorbidities are existence at a higher rate with communities of color, thus has exacerbated COVID-19 among Latinos. So what have we done in the city of New Haven? We have ensured that pop-up testing sites are readily available in those respective communities that really people can have accessibility and be able to walk to. We have ensured that contact tracing people that are isolating and quarantining and being able to be bicultural and bilingual in our efforts in contact tracing. We activated a hotline early on to make sure that people, when all these doctors' offices and emergency rooms were not able to see individuals, that they had a number to call to be able to have their questions answered around COVID-19. We also wanted to work closely on developing a campaign that was really about peer-to-peer education, utilizing community influencers to be able to talk and communicate as trusted leaders in the community. We also geared up a Masked Up campaign and are happy to report that many of the community influencers, because of that, played a part, and 82% of Latinos are reported to be in compliance with adhering to the mask use. So as I wrap up, what is the call to action that I want to leave with you this afternoon is really being able to serve as an advocate, being able to ensure that resources are prioritized for communities that are predominantly most affected by this, which is Hispanics, Latinx communities, and African American communities. Work across every other sector to be able to ensure that services are going to be readily available, not only healthcare, but also their basic needs, and also promoting with us on the precautions that are necessary to be able to mitigate this pandemic, and work with employers to modify policies and be able to allow more flexibility, because what we have seen is people having a fear of losing their jobs when we inform them that they have to quarantine or isolate because they're positive. And also help us spread the facts and not the virus. One of the things that we have seen, there's a lot of misinformation coming down even from the federal level. And so being able to assist us with ensuring that people know the proper information. And as always, as I close, please know the symptoms, stay safe, and stay updated on the most latest COVID-19 efforts, and being able to prevent and making sure that you follow the 3 W's. Wear a mask, wear it correctly, wash your hands, hand sanitize, and watch your distance. And with that, I will turn it back over to our facilitator, Fernando.
Thank you, Maritza. That was certainly a lot of information to cover in a short period of time. I did see in the chat that we want to remind everyone that we are going to make that PowerPoint available to all attendees in the post-forum email that will go out. And I invite you to begin asking your questions in the Q&A section of either Maritza or Frances, so that we can engage in that discussion after Frances speaks. So let me turn it over now to Frances. I know that you have certainly a more global perspective doing statewide policy work in this area. So what would you like to share with us today?
Absolutely, and thank you. I'm just delighted to be part of this inaugural forum, part of this panel. Maritza, thank you so much for that overview that really is so important. When you work at the statewide level, sometimes you don't get the granularity of what is happening at the local level, and I really appreciate you making it real for us. And you are terrific at going through 40 slides in less than 10 minutes. So I want to start, actually I want to start with the personal, because I live here in New Haven. I live in the Westville neighborhood, and the presentation that Maritza just gave us made me think about a report that Data Haven just published in June about inequity in health and the social determinants of health and the impact of COVID. And, I have family in the Hill, and if you had 2 couples having children today, one here in Westville and another in the Hill, the life expectancy of the child who is born in the Hill is 70.1 years. And the life expectancy of the the child born in Westville is 85. And that dramatic difference in life expectancy has everything to do with the disparities that exist by race and ethnicity, by immigration status, by socioeconomic status. It has everything to do with what Maritza was talking about with respect to access to transportation and access to food, reliable health insurance through your employer. All of those things really make that difference. And so we have much higher rates in our community, in the Latinx community, Hispanic communities, of diabetes, asthma, hypertension, cancer, all of those things. And COVID has exacerbated that in our communities. And so when we see the death rates, when we see the complications that require long-term hospitalization, it's because there are so many underlying factors that affect the health of people, and COVID has exacerbated it. So the point is that we need our health to live and thrive. And at some point in our life, we also need healthcare. So the Universal Healthcare Foundation of Connecticut, our mission is to fight for quality and affordable healthcare for everyone in Connecticut, and particularly for people who are at the margins, people in the Latinx community and people in the African American community. Consistently throughout, even though Latinos are about 11% of the population in Connecticut, we are more like 20% of the uninsured. Even though Americans are about 15% of the population, the African American uninsured rate outpaces their representation in the community. So the pandemic has made this worse. We have higher unemployment. We estimate that the rate of uninsurance, loss of insurance, has gone up to 30% or by 30%. And so we have developed a set of advocacy priorities for the during this pandemic. And back in March, we thought it was just going to be a few months, right? Now we're thinking it's probably going to be a couple of years until we have a vaccine and until people feel safe getting the vaccine and until we can go back to whatever we think is going to be the new normal. And so our initial priorities have been about testing and treatment, and more recently, contact tracing for everyone who needs it without cost sharing. There's so much confusion out there. And even we at the Universal Healthcare Foundation have a very difficult time parsing out the facts. There's so much confusion about who has to, do you have to pay a copay for a test? You can go for free testing in some sites in New Haven, and then you go someplace else and you have to pay anywhere between $600 and $2,400. There is really no rhyme or reason, and we don't really have a public, well-coordinated campaign to help people understand where can you go for testing, under what circumstances will certain places test you. Some places might tell you that if you're not symptomatic, they won't test you. Initially, you had to have a doctor's referral, and then that was changed. Lots of trouble with really getting good public information out. So we have been advocating for no cost sharing at all. And whether you're you're privately insured or otherwise, whether you're getting your insurance through your employer or buying it on your own. And we have been advocating for the payment of telehealth services. Maritza mentioned mental health. Mental health telehealth services have actually proven to be extremely helpful during this period of time. People who were already going to therapy have actually found, in some cases, it really is very dependent on whether you have enough space in your home for privacy and those kinds of things, whether you have Zoom and those kinds of things. But telehealth services fairly paid for. That's been very important. Direct relief to people. Undocumented immigrants do not qualify for the federal aid. They don't qualify for state aid. And actually what state aid has been available has been very limited. And so direct relief to undocumented immigrants and protection of essential workers. The people that have been risking their lives to check us out at the grocery store, to deliver our packages to our home, and to take care of us in nursing homes have needed advocacy because they've been not sufficiently attended to. We've been watching the whole progress of the development of vaccines and treatment drugs at the national level, and watching carefully and advocating against price gouging and making sure that the prices at which these vaccines and drugs become available, when they are available, does not adversely impact communities of color or communities in general, because the pharmaceuticals will try to make as much money as they possibly can. And finally, a priority during this period has been to protect the right of all eligible voters to vote safely. So we have taken it upon ourselves to do as much public education and engagement around the issue of mail-in voting and making sure that people understand what is possible to do and how to vote safely. So there's a few things that are important to know about the next few weeks that I want to share with everybody, because there's lots of sort of nitty-gritty stuff. November 1st to December 15th is the beginning of the new enrollment period for individuals who are buying their insurance on Access Health CT. That is Connecticut's insurance marketplace. And we have many, many people who buy their insurance on their own because either they can't get it through their employer, or in this case, during COVID, some people have become uninsured and have to go get it on their own, okay? accesshealthct.com, that is a very important email address. You can get information about what you need to do to enroll in insurance or re-enroll in insurance. One of the things that is important to know is that if you lose your job, the open enrollment period ends December 15th. Say that on December 20th, you lose your job. You have 2 months after that to go to Access Health CT and enroll for insurance. Just because the enrollment period closes December 15th doesn't mean that if you lose your job and you lose your insurance that you can't buy insurance. So that's important, those dates. The other is that they have online and phone capacity for you to buy your insurance, select a plan, all of that. But many people in our community, in fact, the majority of people in our community show up in days before COVID to the centers, and they have their paperwork under their arm in a manila envelope, and they want to talk directly to somebody. And Access Health CT will shortly be announcing community-based sites that people can go to and actually in a safe way be able to see a person and get help selecting their plans. So the other piece that's very important in our community is Husky recertification. So the State Department of Social Services waived recertification requirements for a period of time, and that waiver is due to expire on October 31st. If you are on Medicaid and you need to recertify, you should be prepared. You should be receiving material from the Department of Social Services letting you know that you've got to file for your recertification. If they extend it, which we are advocating for, wonderful. But if it doesn't get extended, you need to be ready to apply for recertification so you don't lose the continuity of your coverage. There's 3 imperatives for policy in the coming weeks and months. There's a special session that's taking place next week on the 29th and 30th. That's Tuesday and Wednesday of next week. The legislature is going back in, and they will take up some issues, but they don't have healthcare on the agenda. We've been advocating that they need to have no cost sharing for COVID-19 tests and treatment at all, whether through your employer or you buy your own plan. We also are advocating to increase the health equity by expanding the coverage of to immigrants and creating subsidies to help people buy private insurance. This is really critical to expand Husky to all immigrants regardless of status, and also to create a subsidy pool that helps people who aren't being helped enough by the subsidies that are available in Access Health CT. And then lastly, to make sure that if your children are covered in the Husky program, that parents also can be covered by raising the income eligibility level of those parents to twice the poverty level. Right now, you can have your kids covered by Husky, but if your income is $1 too high above the federal poverty level, you don't qualify, and therefore unable to get Medicaid and also unable to afford coverage on the exchange. So here's what you can do. Attend Husky for Immigrants. There's a Husky for Immigrants rally tonight in Hartford between 6 and 8 p.m. at the Governor's Mansion. And that's being organized by some coalition partners, Connecticut Students for a Dream among them, and the Universal Healthcare and Foundation and others. Another thing you can do is to contact the governor and your legislative leaders in the House and Senate and let them know that they need to take up healthcare next week. That they keep saying, oh, we'll deal with all those issues in 2021. 2021 is too late. People are sick. We're moving into a peak. the high prospect of a peak. And so they need to deal with these things now, not wait. And then lastly, voting. It's a priority. Make a plan to vote and get everyone around you who can vote to make a plan and be ready to vote. Next week, we will be releasing a toolkit called I Am a Healthcare Voter, and it will provide nonpartisan information on questions that you can ask your candidates about healthcare. Questions like, what are you going to do to make sure that undocumented immigrants are able to get coverage through Husky? And other kinds of questions. How are you going to make healthcare more affordable for all the people that have lost their jobs? And lastly, it'll include tips on how to hold candidates accountable once they get elected. I recommend that you follow us on Twitter and on Facebook and Instagram, and I'll put those links into the chat room. Thank you.
Thank you very much, Frances. I think you all have done a wonderful job of outlining both the local response as well as the larger policy response. And we have a couple of questions in the chat that will build on what you've already presented. One is specifically for Maritza about that local response. An attendee wants to know how you would describe New Haven's COVID trajectory so far. Are things stable now from the early parts of the pandemic, or do we need to go further in lowering infection rates?
Actually, that's a good question. So I'm obsessed with monitoring our data and how our city is doing. We are currently in a downward trend, which means that we are looking really good right now. And it has a lot to do with a lot of the efforts that we're doing as a community. So what I will ask is for us to continue to do that, because we are seeing a spike in other regions across the state. However, in New Haven, our numbers are relatively low. We did see a spike of about 3 weeks ago and saw that there was a spike among younger children. And so it's really critical that we continue the importance of messaging to our children as well.
Yeah, I think I certainly, you said early in the presentation that no one expected it to go this far. And now that we're settling into the idea that this could take years, I know that a lot of folks are sort of COVID fatigued, right? They're ready to get back to some kind of level of normalcy. So, I appreciate your point that, we need to stay on message and need to continue with those precautions. There are a couple of other questions. One is for a larger sort of policy question as it relates to the ACA. And so, Frances, maybe that's something that I would send to you is what happens in Connecticut if the Affordable Care Act is overturned?
Well, if the Affordable Care Act is overturned, one of the biggest impacts in Connecticut is that the provision in the federal bill that would that really prevents any insurance company from denying you coverage on the basis of pre-existing conditions would go away. And that would affect everybody, really. That would affect people who have private insurance through their employer, people who buy insurance on their own, because now we would go back to the days when if you were a survivor of breast cancer, for example, you had to, you couldn't get insured for 5 years, even if you were in remission. And so that is one of the major protections of the Affordable Care Act. And another loss to Connecticut would be hundreds of millions of dollars in subsidies to make healthcare more, health insurance more affordable to people who have to buy it on their own. Connecticut has a very expensive healthcare system, and it shows in our premiums and our deductibles and out-of-pocket costs. And so one of the reasons that the Affordable Care Act has built-in subsidies is because of the high cost of healthcare. We are working at the foundation advocating for addressing the underlying costs of healthcare, but until those costs are actually brought down to meet a definition of affordability, depending on your particular situation, the subsidies are absolutely needed.
Thank you, Frances. There's a question in the chat asking if we would help guide folks to agencies that help with rental assistance needs. And I think maybe I'll make a note of that for the foundation staff to include a list of those agencies with the email that goes out after the chat. So folks have that as a resource. A question back for Maritza about the local response. Can you expand a little bit on the contact tracing efforts in New Haven and the state? And how are we doing in terms of recruiting tracers, or, are we gonna have enough should we experience a second big wave?
Yeah, so, that's a great question. From the very beginning, the position that the city of New Haven took was to ensure that we had a contact tracing platform, although it did not exist statewide. So we developed the contact tracing effort that consisted of over 170 medical reserve and student volunteers. We had a sustainable plan. The state since then has created a state platform called Contact CT. And has also scaled up to be able to have a combination of staff throughout the state local health departments, as well as medical reserve corps members to ensure that they have the capacity. We also just recently received a grant, so we'll be having a lot of different health departments across Connecticut will be hiring additional contact tracing. And so it is in place and definitely available to scale up at a moment's notice if we should see a surge.
Thank you, Maritza. Raquel Santiago Martinez, longtime PLF advisory board member and supporter, asks that the point that you made about equity versus equality really intrigued her, and she wondered if you could expound a little bit on that as it relates to healthcare.
I think that was for Maritza.
Yes. And Maritza, you're muted.
Got it.
Yeah.
I'm like, I think I'm still muted. So when we talk about the, health equity in a lot of the work that we've done, I've done in the last 20 years, really consists of, is health equity a standard that's being adhered to? And so when we talk about health equity, it's really achieved when everyone has the same opportunity to attain their full health potential. And over again, the data continues to show us that there's still a disparity of equal access to healthcare among communities of color, in particular Latinx communities. And so when that is eliminated, we know that regardless of social position or other social determinant factor, then we can get to having an elimination of disparities. And so, when we talk about equality, it doesn't necessarily mean equity, because although something's offered, it doesn't mean that it's equitable, and does a lot of different factors, such as experiencing a racial inequity within the system. And so a lot of different factors are affecting the ability for us to be able to have an equitable way to be able to get quality services.
If I could add to that too, I think that what it means as well is that when you're looking at the fact that not everybody has starts from the same place, when you create policies and programs and interventions, you have to understand who you're working with and who you're trying to benefit, and really tailor the interventions, the policies to them, so that that means that some groups are treated differently, and a lot of policy in particular has this tendency to be really broad brush, and the idea that if you do something that is going to benefit everybody, that the people with the most disadvantage would benefit anyway. It's not true. Rising tides do not lift all boats. You have to be much more attentive to the difference between equity and equality.
Thank you both for that. I'm reflecting back, Frances, on that example that you shared about the life expectancy of a child born in the Hill versus one born in Westville. And I was shocked by how large that gap is. And I'm wondering what PLF or the foundation or members of our audience today can do to influence closing that gap in life expectancy.
Good question.
That is a good question.
I think I think we have to, so I'm going to answer it from an advocacy perspective. I think that all of us who are working in social change, right, whether it's providing direct services or it's running a city agency or it is in the legislature, really have to think about the fact that these disparities need to be eradicated, that we have to work on this and that it has to be central. And if anything, the COVID pandemic and the civil uprisings, the racial justice civil uprisings, have really brought into focus for us as a country and as a community is that race matters, ethnicity matters. Like, let's not try to just, get past it. No, it matters. Let's talk about it and let us really figure out, and when we're in boardrooms or when we're in public hearings or wherever we are in our, the manifestation of our work, that we're making these statements and saying, wait a minute, how are people going to be better off?
Yeah.
And how will we know? Yeah.
And I think I would add, just to complement what Frances said, it's so critical. I mentioned it during my presentation quickly about these social determinants, right? So there's all these different social factors that already put us at a disadvantage. And and being myself, being raised in Fairhaven and being a product of that, and my inspiration to go into public health, recognizing first that I have a voice and I represent a lot of people that are voiceless, and remembering that we can influence system changes. But even furthermore, at the community level, everyone's voice matters. And I think we have to take a stance in the Latino, Latinx community to make our voices louder, to really get out and vote, and really be able to hold individuals in political positions that are representing us, to hold them accountable to their responsibility in creating policy changes that are going to address these systemic issues, so that we can finally see a change in our life expectancy, so we can finally see a change on these chronic conditions that are affecting predominantly communities of color at such a higher rate. And so, I love Frances' point about advocacy. We have to get to a point when enough is enough, and we need to start advocating and making our voices heard.
And if I could just add one final, I think we have to ask for the big things. We ask for things that are way too small. We have to force our policymakers into courageous leadership. And I have an old colleague who hasn't been at the foundation in several years, but he used to say the people are ahead of the leaders. And I think that is only true if we get out there and we say, there is a right to healthcare. Healthcare is a right. It's a human right, okay? And universal healthcare is possible. We're the only developed country that doesn't have it, okay? And it is possible to eradicate disparities. We can break down systems of oppression. We can do it.
Thank you, Frances. And this is certainly the moment to push for that kind of radical change. I mean, if nothing else, the pandemic has revealed structural problems that existed in our society before this pandemic started. And, we've seen just how inadequate it is to base a healthcare system on employer-provided healthcare. When we've been hit with both the pandemic and then the subsequent economic turmoil and unemployment, it just reveals how inadequate that system has been. And I think like other systems, we're going to have to change the way that we deliver care and the way that we deliver social services. We have a question exactly on that from one of the attendees who asks, based on your experiences with social services, do you think service delivery will change in a post-COVID environment? And if so, what do those changes look like? I know certainly for me, my organization, Community Solutions, there are a lot of things that we're never going back to doing. And it's, this has opened up telehealth in a way that we never expected to do. So I'm sure there are a lot of other things that you can envision will change. So what do you think those things might be?
So I'll start. I think for us, because we do offer a lot of delivery of services, it's already changed. And it is going to change forever. And I think a lot of social services agencies are going to have to start thinking creatively of how we're going to now reach communities, because we are going to have to go to them. And how is that going to work? And a lot of this office setting structure, it's no longer feasible. And, to say the least about telemed, and Frances alluded to this earlier, telemedicine has and should have been in place decades ago. And so here we are now in Connecticut being faced with it. I remember in my prior role of trying to get grants for telemedicine and continuously being denied in Connecticut because we weren't ready for it. And now the pandemic is forcing us to be ready.
Mm-hmm. And we have
and
to
prepare.
remember that there's a digital divide, right? We have to remember that telehealth is actually an idea whose time has come, and we got catapulted into it by the pandemic. Yet there are people who don't have the bandwidth, they don't have the devices, they don't have whatever it is. There's still a digital divide. So I think that we have to also remember and account for that and make it possible for there to be equitable access to telehealth services. I do also believe that in-person services will continue to be important, and some people will not just need them, but want them and need them. And so we have to not throw the baby out with the bathwater, as the saying goes, right? I think also that another area that is being challenged in this time is advocacy and activism. And, the protests that, the rallies and protests that we saw during the summer were really an example of the human spirit really feeling like it could no longer, that we could no longer hold it in. The question is, can we maintain activism during a time when you're still trying to stay socially distant? I think we can. I think that the people who have been organizing others to be activists are learning how to do activism in ways that are safe and in ways that engage people. And in some respects, when you have folks who are pressed in their daily lives, they may have 2 or 3 jobs, they have 2 or 3 kids, they've got everything that they, have to deal with. Do they have time to go to meetings? Do they have time? Do they have the flexibility to take the day off and go sit in a hearing room at the Capitol? No. But this pandemic has shown us that we actually can get people through Zoom and through other ways of virtually meeting engaged more than they would have otherwise. One of my colleagues is on the Board of Ed in a town in Eastern Connecticut, and she says that there are more people attending Board of Ed meetings now than there ever were before the pandemic. Like, a lot of people showing up because the technology makes it easier. So that's an advantage, I think.
Thank you, Frances. So we are nearing the end of our scheduled time, but I have one more question that's been sitting in the chat for a couple of minutes, back to the local response, and it's a question from Maritza. What are you hearing about the need for PPE for essential workers and other vulnerable populations at this stage in the pandemic?
So that's a good question regarding PPE. We've been doing a lot of education around that, on the importance of mask use and what type of mask use should be prioritized for what group. As far as PPE for the healthcare frontline workers, We continue to work regionally and locally to ensure that they are looking at their burn rates and preparing for any potential surges. We're creating a COVID-19 specific healthcare task force on a grant that we just received to ensure that long-term care facilities and other partners will be at the table sort of making those assessments. And it's really important because we saw that in the beginning of this pandemic, that was an issue, not having sufficient PPE. And then also what type of PPE for community individuals. And so what we are learning now is that there are a lot of different masks that are not recommended for the community. So for example, the masks that have ventilators on them, masks that are not more than 2-ply and folded twice, that being able to have 2 or more of the ply material. In addition, bandanas or the neck gaiters that people are wearing, those are not recommended. And so making sure that people also know how to wear them correctly. So we are continuously trying to work on how do we educate the community on the proper mask use and what type of mask use is important for them that will provide protection.
Thank you. And I want to thank both of you really for taking the time to share your insights with us. I know I've learned a lot today, and I'm sure that the folks in the audience have learned a lot from both of you. So as we're ready to close, I just want to remind everyone about that call to action that Frances made during her remarks. The legislature is going into special session. We need to ensure that they're taking up the COVID-related bills to help the state get through this pandemic in the long term. So please contact your legislator and ask that testing and COVID-related care continue without copays until the end of the pandemic. It is essential that care be provided to all of Connecticut's residents during this critical time. So we want to thank you on behalf of the Progreso Latino Fund for joining us today. We hope you'll join us at the next PLF virtual forum, which will happen on October 27th at noon, and we will focus that day on education. So thank you so much for taking the time, and we hope you and your families are staying safe and healthy.
Thank you very much.